What's going on, everyone? Cyclops from Paramount. Cyclops here. Welcome. Paramount is, I don't know, running around causing havoc somewhere, which kind of scares me a little bit, but I'll find him later. But I do want to make an announcement real quick before we get into the story on my $1,200 giveaway. I am working out the logistics of it, and I'll put up a video probably either today or tomorrow on the details of how we're going to do it and how you get yourself entered to win the money. It will be $1,200. I'll split it into $300 sections. That way I can give 4 prizes away, 1 a week. It's not much. I mean, I wish I had more to give away. I would give away more if I had more, but it is something, and it's something that I think you guys would appreciate. You guys could desperately use. I mean, who couldn't use an extra $300, right? So, let's read this from NBC News. Will the new COVID vaccine be safe? What the scientists want to see. Surveys have shown that the public trust in a COVID-19 vaccine remains on shaky ground. I mean, and you can't really blame people for being a little shaky about it. It's a new vaccine. It's come out pretty quickly. People want to make sure it's safe before putting something in their body. That's reasonable, I believe. That's understandable. Sure. The first experimental coronavirus vaccines could be available by the end of the year. And while that's welcome news for public health officials, surveys have shown that people's trust in a covey vaccine remains on shaky ground. Again, it's just because it's new. We don't know. We haven't seen it. And we've got 3 vaccines out now. AstraZeneca has one, Moderna has one, and of course Pfizer has one. Now, Moderna and AstraZeneca's both only need refrigerator temperatures to remain viable. Pfizer's needs to be kept at a negative 97 degrees Fahrenheit. So, I don't know. Are we going to use all 3 in conjunction? How are we going to do it? I don't know. I don't know. A Gallup poll in November found that 58% of Americans say they would get a covey vaccine, up from a low of 50% in September. But there are still worries that the speed of developing and testing the vaccine may have compromised their scientific integrity. And that's a reasonable thought. Nothing wrong with thinking that. Nothing wrong with taking that caution. Nothing in the world wrong with stepping back and saying, wow, we did get this out pretty quickly. Is it safe? You're putting it in your body. I mean, I understand completely. I get you. You don't get anything but, hey, I understand from my corner. In a White House task force briefing Thursday, Dr. Fauci had tried to settle concerns about the safety of the 2 vaccines, for which early phase 3 clinical trials results have been reported, and they generally show pretty good. But I remember there had been vaccines in the past where it took months for the results of the trial and side effects to be known. It's possible. Nobody's faulting anybody here on this channel for being scared of the vaccine. It's a new thing. We don't know. We don't know. Should be safe. I hope it's safe. Personally, do I believe it's safe? Yeah, I believe it's probably for the most part safe. There is always going to be a little thing in the back of my head that says, well, there's a chance something could happen, a chance there could be some side effects, a chance of allergic reactions, but then there's that chance with every vaccine. The process of the speed did not compromise at all safety, nor did it compromise scientific integrity, Fauci, director of the National Institute of Allergy and Infectious Diseases, said. It was a reflection of the extraordinary scientific advances in these types of vaccines, which allow us to do things in months that took us years before. Yeah, I'll subscribe to that. I can see that. We definitely have some pretty fast scientific advancements, and things have gotten a lot easier and quicker. But still, in the human head, you got to figure you have 2 people that build cars, and one guy builds a car in a day, and one guy builds a car in like 10 minutes. And you show up and you're like, that guy built a car in a day. And I know you can build a car in a day because I've seen people do it. You get those car kit things, and I've seen people build a car in a day from those car kits. So then you look at the guy with 10 minutes, you're like, yeah, no, there's no way you built that right in 10 minutes. And it might look good on the outside, but in your head, whether it's good or not, it doesn't matter. In your head, you're going to second guess. You're going to be like, you had to have cut some corners. You had to have done something. But now imagine the guy that built it in a day had, the basic tools. But the guy that built it in 10 minutes had some high-tech stuff that automatically built it. Well, then that would add credence to it. We have a lot of high-tech stuff now. Fauci is confident in the process. Good, I guess. But what are scientists paying attention to when it comes to vaccine safety? Trial size and design. Larger is better. The larger the trial size you have, the larger the sample, the more individuals you can look at, and the more scenarios you can look at, essentially. Clinical trials are typically made up of 3 main phases, but not all vaccine trials are designed the same way. In general, larger trials are ideal, with participants across age groups and ethnicities, because they will provide researchers with more data about how a potential vaccine performs in different populations. Large trials are also more likely to pick up on any serious safety issues, according to Daniel Salmon, director of the Institute for Vaccine Safety at the Johns Hopkins Bloomberg School of Public Health. Yeah. The more people you have, the more likelihood you'll find a chink in the armor, essentially, which makes logical sense. The issue you want to think about is size. Size matters because it tells you how rare of an event you can detect, said Salmon, who served as a director of vaccine safety in the Department of Health and Human Services National Vaccine Program Office during the 2009 H1N1 swine flu pandemic. I don't really remember the H1N1 swine flu pandemic being a pandemic. It wasn't anywhere near anything like this. The vaccine candidates in late-stage clinical trials in the United States, including the vaccines developed by Pfizer and Moderna, and AstraZeneca has just barely completed their late-stage trials. And they've just yesterday announced a 90% efficacy, you know the word. It's 90% effective. By Pfizer and Moderna are considered very large because they include an average of 30,000 volunteers each. That is a very large sample size. Wow. Both companies also recruited a diverse group of participants and included people of different ages and medical backgrounds. Moderna's trial. I'm not bored. It's just early in the morning. Moderna's trial, for instance, enrolled 5,000 people with high-risk chronic disease. Good! That's what I want to see. I want to see a trial study that takes into account multiple individuals. That's good. How well it protects. Pfizer and its German partner BioNTech released additional data Wednesday following the completion of their Phase 3 trial. The companies announced that their vaccine was 95% effective at preventing symptomatic covey, an improvement over the 90% efficacy. That was the word I was looking for. That one right there. Efficacy. Efficacy. Whew. Efficacy. That Pfizer reported in a preliminary analysis a week earlier. Moderna said Monday that early results of its Phase 3 trial showed that company's experimental vaccine is 94.5% effective at reducing infection. Experts say these results are encouraging, but more data is needed to know what they mean. 95% effective is amazing, but the question is, effective at what? Simon said. Does it prevent contracting the disease altogether? Does it prevent clinical disease? Does it prevent serious disease? And does it prevent transmissibility? Those are different questions. Yeah. And those are all questions that at some point are going to have to be answered. Whew. Well, the Food and Drug Administration will assess the data, the emergency, what's the word I'm looking for? See, it's too early in the morning. I can't think right. Hold on a second. Let's try this. Approval. Wow, that worked. The emergency approval for their drug. They're expected somewhere about the 11th, 12th, 13th of December to have the announcement, and then the very next day they'll start stabbing. Not stabbing, you know what I mean. You know what I mean, immunizing. Don't go all crazy on the comments. Throw me a like, a comment, a subscribe. Besides, you're going to want to be subscribed because that's the only way you're going to get a chance of getting the money that I'm giving away. So, anyways, let me know what you guys thinks. Let me know what you guys thinks. Let's me knows what you guys thinks. Let me knows what you guys thinks. I love you guys. See you on the next one.